Good afternoon, everyone. Can you hear me? All right? So we are really very happy to be back in Atlanta. I lived here for roughly 8 years as the Director of Public Health and then Public Health and Wellness. And amongst many things that we were able to accomplish, you may have heard of the REACH grant, which is a CDC program focusing on racial and ethnic approaches to community health. We had a REACH grant. We had Atlanta Coalition for Access to Care grant from HRSA that came under my administration, and many, many other things that we felt very, very positive about. And I had the opportunity to spend some time at Morehouse School of Medicine working with Dr. Satcher and produced actually what many consider a landmark study called What If We Were Equal, looking at death rates between 1980 and 2002, and looking at the extent of excess death, particularly in the African American community. So it's a piece of work I'm very proud of. Certainly, I want to make sure I thank, and both my kids went to Spelman. I should mention that. Yes, my pocket hurt really severely for that. And I want to thank Sue Roche for inviting me here and for the amazing 12 outstanding provisions that we hope to talk about maybe at APHA in some kind of a way. So I am the president of APHA, it's American Public Health Association. I met at least one person who was a member of the organization during this big session, and hopefully you all know about APHA. Minimally attend the meetings and maximally become a member of the organization, and even beyond that, become a leader in the organization, because we're always looking for good, strong leadership at APHA. Our meeting this year is in Boston, for those of you who live close to Boston or just want to come to the meeting, and it's in November 4th to the 8th. I think it's always instructive when you meet with a new group of people to tell them a little bit about who you are. And I think that's an important opportunity to just let you know that I come from a little garden community called the South Bronx, New York. Some of you may have seen the movie Fort Apache with, I forget his name now, Paul Newman. That's my neighborhood, and it kind of looked like that when I grew up. So I grew up with my mom, my two brothers, and myself. My father decided that about age 4, he had something else he needed to do, and he left us. So I grew up as one of 3 boys with a single mom, and my wife and I talk about this a lot, about my experiences growing up. And we were poor. We slept on the roof for ventilation, called it tar beach. Some of you may have heard that term before. We lived with other people lived in our apartment that had 6 and 4 legs. It's roaches and rats. You know, that was that was kind of the experiences that we had. So it's an interesting life when you live in a poor environment, and we were so poor that we took the OR off the end because we couldn't afford the OR. We were just po. It's instructive in a lot of ways, the way I grew up. My wife and I were talking about this the other day, how getting involved in certain aspects of life around music and political activism and going to a community college really saved my life. But it's true. My best friend was found floating in the East River, obviously dead for some unknown reason. And this is people I grew up with. A lot of them wound up in jail, pregnant as teenagers, and something steered me in a direction to do the work that I continually do around health equity and social justice. My mother is now 95, and she still lives in the Bronx, at Co-op City. She has a boyfriend. His name is Preston, and we often share this with you. My mother had some challenges with her health. She was sort of passing out, and actually had wound up with a pacemaker. But we thought maybe it's time that she go to assisted living because of her issues. And we talked and talked and talked, and she finally agreed to go to an assisted living facility. So we started looking around for one, found a couple, and on a Saturday morning, about 7:30, called my mother and said, "Ma, we've found a place." She said, "You know what? I've changed my mind. And her boyfriend's name is Preston. And Preston is now coming to the house 4 or 5 times a week. And he's cleaning and cooking, so I don't think I need to go to assisted living anymore. I was not very happy with that, but you know, my mother still has her faculties and she's in control of her life. So I said, well, I tell you what, I decided to mess with her. I said, you tell Preston, if he's not taking care of you properly, I'm coming to the Bronx and I'm gonna kick your butt, his butt. So she said, well, you know what, you can tell him yourself. 7:30 Saturday morning. So we refer to my mother as the original cougar. She's 95 and Preston is 80. So one of the things that I learned in my life is that one person can make a tremendous difference. The notion of the power of one. And there are so many examples of the power of one that we could look to in history. Martin Luther King, Sister, what's her name? The Mother Teresa, Nelson Mandela, Malcolm X, whatever your favorite character is. There's so many indications of the power of one and what you can do. Sue herself, in doing this conference for the last year, we understand, and planning. And I put that out there for all of us to constantly think about what power we have as one individual. It doesn't take everybody to do a job to turn the world right side up. One person can make a tremendous difference. We have a video that we use sometimes that has a clip of a child standing in front of a tank in Tiananmen Square, and that tank stopped. So that little child, one person, made a tremendous difference. And I invite you to think about your life in that way. We are all connected. Matter of fact, everybody take 2 deep breaths and exhale. Deep breath, inhale, and exhale. Again, inhale and exhale. Well, you've now shared your molecules with the whole room. So we are connected. Deepak Chopra talks about metabolizing stress hormones, that when you're stressed and your hormone levels are very high, they are metabolized and they come either through exhaling or sometimes through your pores. And when you walk into a room where people have been stressed out, there's stress hormones every place, and you suck that in. So you're a part of that dynamic now. So you meet your other cellmates here. I mean, biological cells. My favorite philosophers are kind of interesting. One of them is Mufasa. Anybody familiar with the Lion King? Mufasa is known and known to have said this very profound statement that I love so much, and I make sure I put it on the microphone so you sound like James Earl Jones. We are all connected by the great circle of life. Janetta Cole was the president of Spelman University, and in doing research, actually, my wife found this one, where she said, we create a new family by treating one another as if we were from the same womb, which was a great statement of connectedness that I offer to you. So my career, and by the way, just I should have said this early on, I want to talk with you in a few minutes about looking at this issue that we're all here addressing, marijuana use and legalization or not, from a social justice and health equity lens. A slightly different way of looking at this, but before I get to that, I started out as an individual practitioner. I ran an emergency department in Newark, New Jersey for 13 years, worked in a couple of primary care clinics. And I often tell students who come to me now in public health and ask, you know, I'm not sure what I want to do. I want to be clinical, I want to be public health. And because I've done both, I can tell them some things that from my own insight, that there's nothing more satisfying than being in an emergency department and having a patient come in by ambulance who's short of breath or having chest pain or some other critical presentation, and you make the right choices, do the right things, get the person intubated or oxygen or to the CAT scan or whatever, and then admitted to CCU or ICU, and you literally save that person's life. And they come back down to you a few days later after they've been discharged and thank you for the work that you did. There's nothing more personally satisfying than that. However, it only addresses the issues of one person and maybe that person's family. It's not totally satisfying as a movement builder. And consequently, I got into public health full time. I've been doing that for the last, now 17 years. This most recent 2 years at the University of South Florida on the faculty as a full professor in the College of Public Health. But prior to that, 7 years as Louisville's Director of Public Health and Wellness, 7 years prior to that here in Fulton County as Atlanta's Director of Public Health. And have had the opportunity to affect the lives of literally millions of people. We passed an ordinance in Louisville, tobacco country, tobacco city in tobacco country, such that their Christmas celebration every year was called Light Up Louisville. Brown Williamson was based in Louisville, Kentucky. And we were able to get an ordinance passed that's one of the strongest non-smoking ordinances in the country, where we have 23,000, I keep saying we about Louisville. They have 23,000 businesses in Louisville, and now that we've passed the ordinance, only one allows smoking. And that's a company that does R&D for the tobacco industry. But on the other side of that question is, we see very clearly in Louisville and now in Tampa as well, the extent to which the tobacco industry has done what it did over the decades leading up to the movement to change that and make us a smoke-free state. And one of the conclusions that I'm concerned about is that the same thing will happen with marijuana. Not the least of which, and I know this is clearly illegal, the question of synthetic marijuana. We haven't really talked about that. But our son got a hold of some synthetic marijuana not too long ago and had some severe repercussions with that illness. Wound up spending some time in a mental ward, an institution, because we initially thought he was paranoid schizophrenic. And he's in his 20s, and that's kind of the age that you develop schizophrenia, but it really was based upon getting a hold of some synthetic marijuana. So hopefully that's included in the deliberations and the thought process around what you're doing. So I want to share with you a couple other things before I talk about social justice. And that is that Martin Luther King, who we know very well from the civil rights movement, also recognized how important the health movement is. And one of the quotes that he has is, of all the injustices in health are the most shocking and inhumane. We use the definition of health from WHO. So we don't just look at individual disease. WHO says health is the presence of physical, psychological, social, economic, and spiritual well-being. Well, I added that to WHO. Not merely the absence of disease or infirmity. So it sets a preventive health promotion, multifaceted definition of health that must include things outside of health care. So I put that on the table for us to consider in thinking about this issue around marijuana. The focus is health equity and social justice, and that's what I've been working on for the last 15 years. I think it's worth sharing a couple of thoughts with you about what that means. That kind of a consensus opinion from around the country at the meaning of health equity is the realization by all people of the highest attainable level of health. Achieving health equity requires valuing all individuals and populations equally and entails focused and ongoing societal efforts to address avoidable inequalities by assuring the conditions for optimal health for all groups, particularly for those who have experienced historical or contemporary injustice or socioeconomic disadvantage, or those who are living on the margin, you might define it that way. And the flip side of the term that we've been using, as a matter of fact, President Carter used it this morning. He mentioned disparities. In this context, disparities have been used for differences in disease outcome and onset across populations, but we don't think that's severe enough to address the issues. I was going to mention a bit later, I'll mention it now. For instance, of all the arrests for marijuana-related charges in Washington, D.C., 91% of the arrests were African Americans. And there are examples like that all over the country. Clearly, there's something wrong, more than a disparity, because inequity talks about systemic, unfair, and unjust differences in health outcomes, et cetera, that are sustained over time and generations and are beyond the control of an individual, which suggests societal efforts, societal power to make changes to give us a world that's more equitable and more egalitarian, which is what this is really all about. So social justice is what is the frame in which I think we need to, or the lens through which we need to see the work that we do, even in this context. And social justice talks about fairness, it talks about equity, it talks about universal access to the goods and services of society that are not based upon your race, your skin color, your ethnicity, your sexual orientation, your disability status, et cetera. It's a broad-based egalitarian notion. And social justice is what we all seek, but we've talked about it for years. And human rights goes along with that. There's a famous document that we all know very well, which talks about rights. It says we hold these truths to be self-evident, that all people are created equal and endowed by their creator with certain inalienable rights, and among is a life, liberty, and the pursuit of happiness. Doesn't say health, but the constitutional lawyer will tell you, you can't have health, you can't pursue life, liberty, and pursuit of happiness, without health. So it's implied in the document, it's probably implied in the Constitution as well. And for those who are believers in the Second Amendment, I would say I'd love to see more focus on the right to health than the right to bear arms. You can keep your guns if you're a proponent. I personally have other thoughts about who should have guns and why, but that's not why we're here today. So health is a basic human right for us. We believe that. We should see the unfolding of the drama around marijuana in that context. Is it best to the best way to maintain a belief and a focus on health equity and social justice and human rights to legalize marijuana or not? I'll tell you now that American Public Health Association is very clear. We do not support legalization of marijuana. We think that there's a potential role for decriminalization. But in the bottom line, the analysis of this issue, marijuana cigarettes, or reefers as we used to call them when I experimented with, along with Jimmy Carter's sons. We didn't know each other. We had the similar experience in that we both did this. In the Bronx, in the streets, we called it reefer. I don't know about any of you if you would admit that you had the experience and what it was called when you did, but that was a long time ago. But I ask that we take a look at this in the context of social justice and human rights. The next piece of this is a quote from Einstein, a paraphrase from Einstein. There's another piece that goes along with that as well. The Einstein's comment is, if we continue to do the same thing in the same way and expect a different result, we're crazy. It's a definition of insanity. So we've not yet gotten to the place where health outcomes are equitably distributed and we have the world that we'd like to have. Substance abuse is a good example. I spent a couple of years working in South Carolina in a methadone clinic. There was no parity at that time, no parity in terms of substance abuse treatment. The small private operations that did addiction management got paid based upon filled beds, not success rates, which was kind of an oxymoron. Said, well, we're gonna pay you money because you fill your beds. We're not because you've demonstrated excellence and have gotten people off of drugs. It's a different way of looking at the world. So there's a different way that we have to find to look at this at these issues. And everybody hear of Moms Mabley? Moms Mabley? Well, a few people. She was a comedian, and she said, if you do what you always do, you get what you always got. It's a very profound philosophical statement. So we're talking about social determinants as the way to look at this issue of health and healthcare and access to treatment for marijuana and other related drugs. Definition from the CDC: the complex, integrated, and overlapping social structures and economic systems that are responsible for most health inequities These social structures and economic systems include the social environment, the physical environment, health services, and structural and societal factors. Social determinants of health are shaped by the distribution, this is an important point, of money, power, and resources throughout local communities, nations, and the world. Education, occupation, and income are three of the major ones. And I made an immediate connection when I was looking at the material that Sue sent me, and that there's a correlation in this study that Sue sent me between marijuana use and dropout rates. Well, there's a combination of factors that jumped out at me. The first is that there was a correlation between that. A part of that analysis is that high school dropouts are more likely to be unemployed by significant percentages, and are more likely to have a shorter life expectancy. So this connection between marijuana and dropouts, high school dropout rates, connects to the rest of the work that we believe is going on around social determinants of health. And not only is it a question of shortened life expectancy, but if you drop out of high school, you're going to have a worse, if you're employed, a worse, that's not good grammar, a poor job that doesn't allow you to have good self-esteem, doesn't allow you to have money to pay your bills, means you're going to live in certain neighborhoods which then become concentrated poverty and no opportunity for you to break out, which then become areas with less service provision, with worse school systems, with no transportation, more likely to be unsafe, with gunshots in the street, no green space, all this connected to somebody who drops out of high school. And one of the things that we recently found out or acknowledged in this work is that the most sensitive indicator of the health of an individual in a population is zip code. Not whether you use drugs, of course that's related, not whether you are obese and don't get physical activity, not whether you're stressed out, but zip code. So part of the process when I look at this issue from my standpoint of Director of Public Health, I see neighborhoods that are blighted, that are vacant buildings where there's very little business. Those are the same neighborhoods where I see liquor stores, fast food restaurants, convenience stores, and on the convenience stores and the gas stations, they're plastered all over the place with alcohol, and primarily with cigarette advertising. So, you know, we organize very effectively around the country to get cigarette billboards out of the picture. But the smaller ones, I don't recall exactly what the size is, are still legal. And you see them plastered, and they're plastered in positions that are designed for kids to see them. So they're lower down on the door or the outside of the building. And you know that, I'm sure you, from the news, you've certainly seen the pictures of the synthetic marijuana in very colorful packets sitting right by the counter at the front of the store to encourage kids to buy that deadly substance. But I guess another example of the way the industry in the tobacco industry has done what it's doing, and that in fact it's going to affect our concern around marijuana as well. The education becomes extremely important as a social determinant, as is housing and environment. Aristotle is quoted as saying, "Tell me how a man died and I'll tell you where he lived." He was probably saying the same thing about zip code, although they didn't have zip codes in ancient Greece, as far as I know. Housing, we talked about. Political power is a social determinant of health. It makes a tremendous difference if you have the power to make decisions around flow of resources, policy changes. For instance, it could have been done a long time ago, but there was a policy there'd be parity between behavioral and physical health, that there would be universal access to drug treatment on demand. You know, we've been talking about that for, I think the first time I heard that term was decades ago, and we're still not there, and that is a major reason that we still have HIV. We've talked a lot about addiction today. Let me just spend a few minutes talking about the elephant in the room, which is still racism. It affects everything that we do. Many people will ask me, well, Dr. Troutman, it's 2013 as an African American in the White House. Why are we still talking about racism? Because it still exists. And you look at the data, if I had time I'd run through the history for you, but look at the data, we're looking at about 1964, which is the first civil rights legislation, to 2013 as being roughly, what, 60 some years? My math is not that good, forgive me. Let's call it 67 years. If I'm wrong, I apologize. But that's trying to counterpose 1619 to 1865 and to 1964. And the difference between those two is where the racism and its effects have been institutionalized in the United States in every institution that exists, every last one of them. It doesn't mean that everybody is a racist. It doesn't mean that all people who don't have to be people of color make decisions based upon that. But if it's institutionalized, you're not even aware of what the forces are that are driving you in that direction. My friend Kamara Jones from the CDC breaks racism down into individually mediated, institutionalized, and internalized. And the quick description is if as an individual I decide somebody with green hair is a criminal, then everybody with green hair that I see, I treat them like criminals. You stay away, you're no good. Now I get a job working for the housing authority, and I take this personal belief with me, and I write a policy for who's eligible for housing. And in the policy, well, why would I want a criminal in my housing development? I write down in the policy brief that people with green hair are criminals. The next generation comes in, the policy manual is there, they don't even think about it. It's now part of their institutional practice. There are lots of examples I could give you, but we don't have time. So that's institutionalized and individually mediated. Internalized, which is probably the most insidious, is when the people who are green-haired believe the stereotype about who they are. So they don't care. After I'm a criminal, that's where I'm going to live my life, and so be it. So it's very, very destructive racism within the system. I'm going to wrap this up and indicate to you that one of the things that we're hoping for is a growth of a movement around social justice and human rights and the right to health. There's obviously a significant place in that movement for the work that we're all doing here and the focus that we're trying to, when I look at this issue, I think we're concerned about people's livelihood, people's health, people's wealth, people's quality of life, and a recognition that there are things out there that are not necessarily very good for us. And we need to be about organizing an effective movement to do the work that's been done over the years, like around tobacco, around the regulation, whether it's going to be legalized or not. Listening to Jimmy Carter's comment this morning saying that he hopes that the experiments in Colorado and California fail because he's not a supporter of legalization of marijuana. That's an issue that we have to find a way to address. So the last thing I'm going to say to you is that this takes risking behavior on all of our parts. And I strongly want to encourage you to think about risk as a part of who you are, and to what extent are you risk averse, to what extent are you willing to take risks to make things happen. And I'm going to end this. I spent a lot of years doing clinical hypnosis as a clinician, so I'm going to hypnotize you all now in a very quick. No, I won't. But I will ask you to close your eyes for just a second. I want to share something with you about risk. And take a deep breath and just close your eyes. To laugh is to risk appearing a fool. To weep is to risk appearing sentimental. To reach out for another is to risk involvement. To expose your feelings is to risk exposing your true self. To place your ideas, your dreams before the crowd is to risk their loss. To love is to risk not being loved in return. To live is to risk dying. To hope is to risk despair. To try is to risk failure. But risks must be taken because the greatest hazard in life is to risk nothing. The person who risks nothing, does nothing, has nothing, and is nothing. He may avoid sorrowing, he may avoid suffering and sorrow, but he can't simply learn to feel, change, grow, love, or live. Chained by his certitudes, he is a slave. He has forfeited freedom. Only a person who risks is free. You can open your eyes. And the last thing I'll say to you is I'm going to wish you, in the spirit of the 24th century, live long and prosper. Thank you.